is your first and last name, and then your county medical society that you work in.
Okay. Richard Butcher, San Diego, California.
Perfect. And the first question is, what inspires you to be a physician? And we're talking right here, this is your audience.
Correct. What inspires me goes all the way back to my childhood days when my two best friends, Donald Lambright and Lawrence Shoemake, fathers were physicians. I grew up in Cleveland, Ohio after moving from Selma, Alabama, and I always stayed on that track. When I got to high school, I had a Latin teacher named Nellie Roseball who said that she wanted me to go to a college called Allegheny in Meadville, Pennsylvania. She knew that I wanted to go into the medical field, even though others were trying to discourage me. I went there, and from Allegheny, I went to Meharry Medical College. I believe that all of that, Cleveland, Allegheny, and Meharry, got me set for this road that I'm taking. Meharry especially, because growing up in the 60s, when I first went to school, that was the beginning of the sit-ins. My professor said, if you want to be in medicine, you can't be in jail. So I avoided going down to the sit-ins. But it was an exciting time. Meharry was a school that got us ready to go into practice right away. So once I finished there, I did go into the Navy and went on to residency in Riverside, California. I've always enjoyed family practice, and that's what I'm still doing today. I graduated in 1964, finished my residency in 1967, 68, and went to San Diego, California, where I've been ever since. I enjoy belonging to the CMA, the San Diego County chapter also, because I think that we need to be together in all of the things that go on. We need to take care of our patients first, but we as physicians need to be involved in the political side also. And that's why I've always stayed through the County Medical Society, the State Medical Society, and the National Medical Society. So that's one of the reasons why I think, and I still enjoy being a family physician today.
That was a really great answer, Richard. Thank you for sharing that. Second question we're asking, is there a specific patient or just patients in general that inspire you? Is there a story that you could tell about that?
Patients are interesting. I have two interesting events. One, again, being in family practice, I always enjoy taking care of the whole family. In my younger days, as I would call it, I did a lot of deliveries, and I had a obstetrician, Dr. Burt in San Diego, that assisted me. He was an obstetrician, but he let me and helped me a lot. But I did a lot of deliveries, and I enjoyed that very much. That started back in medical school. The patients that I take care of now, I'm in a general solo practice with a partner, Dr. Rodney Hood. We've been together for about 25 years. What we have done is started IPA and had a general practice. We're always interested in the neighborhood and taking care of the people there. The things that I can remember about that are there were two issues. One, when the smoking campaign came on to get patients to stop smoking, there was this one patient that I really talked to, and she said, yes, I'm going to stop. We got on the television down in San Diego, and she said, I'm quitting. Then she came in a week later, and I noticed that she had her pack of cigarettes with her. I said, what happened? She said, I couldn't last. And so I restarted again. So we both laughed, but I said, you really need to quit. The other thing that I remember, we're doing several projects in our office of taking care of people. And we have a hypertension project. Again, a lot of people have that, and we go ahead. We send our nurse out to their homes now, giving them blood pressure cuffs, and that has been a big hit. She went to this one patient's house, and she said, oh, your blood pressure's up a little bit. And she said, what are you doing? Said, well, I don't know, but I know that I've got to go see Dr. Butcher. So he quickly popped 2 blood pressure pills in his mouth instead of the 1. So that's the kind of thing. But the most thing that I enjoy is taking care of the entire family, from baby all the way to grandmother.
That's perfect, Richard. Final question is, describe the community that you work in now, which would be San Diego, correct?
I work in San Diego County. It's called Southeast San Diego. It's in the poorer neighborhoods, but it is a very good community. I've been there some 40 years now and practicing medicine. We take care of all patients, and as I stated earlier, we have an IPA called Multicultural Medical Group. But we take in all patients. I've taken care of patients without any insurance, don't charge them anything, take care of patients with all of the various insurance. We started the IPA because we were starting to lose patients to the bigger programs that didn't encompass us. So by the IPA, we could take care of all of the health plans. It has grown over the 20 years that we've been doing it, and now we have about 20,000 patients in our IPA. We have a high Medi-Cal, a high African American, a high Latino population that we care for. But I think that medicine to me is colorblind. We take care of everyone no matter what. We take care of everyone no matter what kind of insurance, and we take care of the entire family. So I think that that's what we need to get back to. I consider myself as the old country doc, and at one time, going through my residency, I had a thought of going back to Cleveland and the rural areas there, or maybe back in Tennessee where Meharry was, and just practicing in a rural community. But I landed up in San Diego, I landed up in the big city, and so I didn't feel that I had to do general rural medicine or practice that way. And so I just concentrated on going and doing everything. But I enjoy all of medicine. I enjoy taking care of my patients when they're in the hospital. I've even made house calls at times. Don't do that so much anymore today, but I enjoy the whole aspect of medicine.
That was great. Do you have anything else to add, Richard?
The one thing that I would like to say is that I think that all of us have to come together. And when I say all of us, I mean all of the physicians. I see a lot of division and I see a lot of separation, and I think that it's important for us to join our local medical societies, our CMA, and our AMA. We know that it costs a lot, but that's the cost of being in medicine. But I think that you get the pleasure of taking care of the families and the satisfaction that's going on. And I think that by doing this, it really makes my life enjoyable. I've been a team physician for high school for 40 years. I've raised 5 children, have a wife, been married for 53 years to her. And I think that they're all part and supportive of my practice and give me that support and give me that encouragement to go on and keep going on. And that's what I continue to do.
That's perfect. That's it.
Okay.
You're done.
All right.